welcome back to my channel. This is Ruffel Manalo from the Faculty of Nursing, Nakhon, Rajabhat University. So we have come to the last topic of this course. Um, we are now in Unit 15, how to communicate with patients in the maternal and child ward. So once again, um, we are the team teachers in this course from the Faculty of Nursing. There were three of us teaching this course. So for the objectives, the student nurses should discover the evolution of maternal and newborn nursing. So you cannot deny that I'm focusing on the newborn, the mother and the newborn in this topic. And that includes pregnancy. So understand the healthcare approaches, explain pregnancy and its signs, determine the physiological and psychological changes in pregnancy, and differentiate each level of fetal development and physiology. So as an overview, maternal and child health, or MCH, aims to focus on providing care to all childbearing mothers around the world from pregnancy to childbirth. And this concept includes the long-term goals in the prevention of morbidity and mortality rates to pregnant mothers and unborn babies. So the evolution of maternal and newborn nursing, it happened in the 1990s where pregnant women received maternal prenatal care, especially in the underdeveloped countries. And the birth parents at home are only attended by midwives, and these midwives were not formally trained at school. And also physicians only attend for situations like complicated pregnancies. So let's discover the family approach to healthcare. So this includes family, of course. Family, two or more people living in the same household, sharing common emotional bonds, and providing for the basic needs of life. Family is very important for growing a family. Okay, especially if one member of the family is pregnant, and parent as well. A parent is a person establishing a parent-child relationship. They carry the child by providing the physical, social, and emotional requirements necessary for normal growth and development. So I got here a lot of terminologies that you need to take note, and you can study this at your own pace. So we have antepartum, postpartum, EDD, we have gestation, gravida, multigravida, multipara, nulligravida, Nagel's rule, para, primigravida, primipara, and LNP. So the signs and symptoms of pregnancy, this includes the average length of pregnancy, which is 280 days or 40 weeks, the maximum. So pregnancy is considered as 3 trimesters of 3 calendar months each. And if the fetus is born after 20 weeks prior to completion of the 37th week, they are called newborn premature babies or premature infants. And if a baby is born after 42 weeks, they are called post-mature. That is like we usually say overdue deliveries. So the sign of pregnancy are group of symptoms and observations that leads to the positive diagnosis of pregnancy. So presumptive signs, probable signs, and positive signs. So for the presumptive signs, this is so early but unreliable and usually only told by pregnant mothers. And for the probable, this is stronger but still not reliable because we can only see objectively about the symptoms. Then for the positive signs, that is definitive, wherein certain procedures are done or the mother is undergoing a certain procedure to confirm the pregnancy. So we had the presumptive signs. We have amenorrhea, nausea, vomiting, urinary frequency, We have also breast changes and fatigue and quickening at 16 to 20 weeks of pregnancy. The probable signs, we have hair sign, bottle sign, shed weeks, abdominal enlargement, and the weeks contractions. And I will later discuss this in your subject, um, a course in the Faculty of Nursing for one semester. So this is it. And for the probable signs of development, it is occurring during the fourth and fifth month of pregnancy. We have palpable fetal outlines, skin pigmentation changes, linea nigra, coalasma, and stria gravida discussed. The probable signs of pregnancy. For the positive signs, the ECG is present in the urine. Okay, there is blood samples as well. For the physiological changes, this includes the reproductive system changes. There's respiratory, cardiovascular, gastrointestinal tract, and the urinary system. And for the integumentary system as well, there are certain um, changes due to hormonal changes as well as in the musculoskeletal system. Integumentary system, so pay attention. Okay, there are some changes. Um, Metabolic changes in the brain. And on the second trimester, okay, for the psychological changes, this comes a lot. Okay, a lot of emotional instances where a mother is anxious, sometimes cry, and sometimes happy, and she always fear about abortion. For the second trimester, this is like a mother to be becomes self-conscious about the weight, overwhelming event. There is little movement that she can feel at 20 weeks, and the husband will be the give the full support to the pregnant wife. And for the third trimester, okay, anxiety comes again. It's because the mother may be afraid about the incoming delivery of the baby, the labor and the birth of the baby. So emotional issues also happens in fathers. Okay, they also feel that, and also mind body interactions of mothers to be dreams during pregnancy is also common. So understanding the common psychological changes that occur during pregnancy will help both expectant mothers and expectant fathers to understand themselves and their partners better. So they should always go together. And the mother is not the only one who is pregnant, but both the mother and the father are pregnant during the pregnancy of a mother to be. Okay. So yoga is also advised and safe for pregnancy. It's even beneficial. So let's go to fetal development. So this is now about the fetus, a baby inside the uterus or inside the mother. So prenatal or antenatal development is the proves in which is proven in which embryo or fetus gestates during pregnancy from fertilization until birth. So it is also known as fetal development of embryology. So this is how it looks like. 9 weeks towards the 40 weeks of pregnancy. For the 9 weeks, as you can see there, it resembles as a baby, but at 40 weeks, it's already full. The organs of the baby is already full and is ready to be eaten. So the age of the fetus is here. The gestational age is the duration of pregnancy calculated from the first day of last menstrual period or last LMP. And so So the changes or development with weeks of gestation is very common for pre-embryonic stage. This is during the fertilization to 2 to 3 weeks. The embryonic stage, this occurs from 4 to 8 weeks of gestation, and the fetal phase usually, sorry, fetal phase starts at 9 weeks to birth. So 9 weeks, this resembles already a human being, anatomically and physically. Right. So the first lunar month, this occurs from fertilization to 2 weeks of embryonic growth. So those are the changes. And we have the second lunar month. This is during the 3 to 6 weeks of embryonic growth. And we have also the third lunar month. This is during the 7 to 10 weeks of growth. Okay. And the fourth lunar month, this is during the 11 to 14-week old fetus. So the fetus is already 12 centimeters at this stage. And the fifth lunar month, this is already 15 to 18 weeks of pregnancy, and the fetus is becoming bigger to approximately 16 centimeters. So the sixth lunar month, this is during the 19 to 22-week old fetus, which is good because this is the viability where the fetus can survive until birth. So approximately the baby measures 21 centimeters at this stage. The seventh lunar month is during the 23 to 26 weeks also. We can see here the um, baby is already 25 centimeters in measurement. Okay. And the eighth lunar month, this is during the 27 to 30 weeks of pregnancy. So the fetus is already 28 weeks, and it's very amazing because the eyes are already open, and during this time, you can see in males that they are already showing their um, gender. So this is the time that the lungs is getting stronger because of the lung surfactant that coats the lungs of the body of the baby. And on the ninth lunar month, okay, so this is when the fetus is already 31 to 34 weeks and measures 32 centimeters already. Okay, for the 10th lunar month, so this is already ready for delivery. So the fetus measures 37 centimeters. To conclude, pregnancy and birth can be a very special time in the life of a woman. The 9 months of pregnancy, as well as labor and delivery, are filled with many physical and psychological changes, as well as changes in lifestyle. So the importance of healthcare throughout pregnancy is emphasized because proper healthcare increases the likelihood of a healthy pregnancy, a healthy baby, and satisfied parents. So that's according to Marriage and Life Encyclopedia. So thank you very much for your attention. If you have any inquiries, okay, you can send me um, your messages through my email. So until next time, stay safe and have a nice day.